No, I'm just waiting for the doctor to get out of our presence. The transcript will reflect the doctor's out of our presence at this time.
At this time, Your Honor, I would like to continue direct examination. For the record, when we had a colloquy about the scope of the doctor's opinion, I had focused on the deposition, completely forgot about his report, which is Exhibit 2005-1 through 32, something like that? 21. And in that, there is not a life care plan, but all of his recommendations to a reasonable medical probability of the care and treatment for Maya Kowalski based on her symptoms and his diagnosis. If you go to the next page, please. 19, or yeah, 20. And so there he goes on. Also demonstrated positive results of physical therapy. Treatment with Dr. Hanna specializes. Basis for diagnosis, much of it is incorrect. She does not meet the criteria. I don't need that, but from that point up, and then the page before.
Mr. Anderson, I looked at it. Let me hear from Mr. Shapiro.
Yes, sir.
I guess I don't know what they're intending to do if Mr. Anderson is supposed to continue to correct on the objection. The basis for the, just to be clear, this is a plan that he had for Maya after one visit in January 22nd, 2017. If the question to him is simply, did you have a plan for Maya's care, you can walk through it, but that's different than saying, as a result of the mistreatment that you allege at All Children's Hospital, do you believe within a reasonable degree of medical probability she has these future problems? That was the basis of my objection because, again, in his deposition, I believe, clearly disavowed any future care opinions because he hadn't seen her. But I don't object if he just wants to continue his direct and ask him about what his plan for the patient was on that day based on his exam.
Well, my recollection of the questions that were asked that we had the sidebar conversations on, or multiple sidebar conversations on, and my sustaining your objections, the concept was that it was an undisclosed opinion, that neither in his report nor in the deposition was there discussion of future, whether it was care and treatment or a future opinion. But this report suggests that he did, in fact, have opinions about future care. And so at this point, I'm going to reverse my rulings, and I will allow the questions that Mr. Anderson had previously asked, to which I sustained. And the plaintiff can continue in direct when we are in front of the jury.
Thank you, Your Honor.
Do you mind if I just get a quick point of clarification, respectfully, Your Honor? And I don't know if plaintiff intends to do this. Does this court find that merely because Dr. Chopra had a plan on this date for several things that he wanted and that his patient to undergo, that would open the door for him to then talk about life care plans in the future as a result of negligence, or just merely that he can discuss what his plan is?
What I was just seeing on the screen was talking about future items. So, certainly I don't know what the doctor is going to say about future items. If it's beyond this, maybe that's going to be an issue. Yeah. But it's clear that he had a forward-looking report that was presumably available to the defense. And as such, I think it's fair game at this point. And that was the basis of my objection, was it was undisclosed, but it seems like it was, at least in part, if not in totally, available to the defense, and understood that that's what this doctor was going to be saying.
And just a last point of clarification, respectfully, the objection the defense is making is any testimony about future care related to future damages, as opposed to, and I don't have an objection to him talking about in his report his future plan of care for the patient. I think those are two different separate categories. Mr. Anderson may not be going back theirs, but I will make the contemporaneous objection.
I think you need to make the contemporaneous objection. And it may be that it is beyond his deposition and his report, but I think I need to actually hear the specific question at that particular point in time and the specific objection. Are there any other issues we need to address?
Your Honor, we had done a request for judicial notice, which the court granted on trial exhibit 23021 and 2301.
What is 23?
And those are, I've got copies real quick.
Can you just put it up so I know what you're talking about?
Put it up. My intention, these are House resolutions regarding reflex sympathetic dystrophy month, and there was one in 2004.
What are you trying to do with a legislative resolution?
I am asking the witness to identify this and asking whether this is further evidence that the doctors at Johns Hopkins should have been aware of the problem of misdiagnosing exactly what they were diagnosing.
I'm unclear. You're asking a doctor from Rhode Island to comment on a resolution by the Florida House of Representatives?
Well, he is licensed in Florida as well, and it's a relatively minor point, but I think it is.
Has he been in the Florida legislature?
Not that I'm not aware of.
My recollection when I handled this before was I'll take judicial notice of it, but as a matter of evidentiary fact, that me taking judicial notice does not make it an evidentiary fact. I think is how I ruled, I don't know, 2 or 3 months ago.
I agree with that. I think that's what you said.
And I don't see this witness being able to talk to us about what the Florida House of Representatives has done.
I'll save it for cross or something else, and I'll bring it up again.
Anything else before we bring in the doctor?
Not from the plaintiff.
Not from the defense lawyer.
Let's go get Dr. Chopra, please. Okay, welcome back, Doctor. Just to let you know, when we bring the jury back in, since we've had this break, I'm going to remind you that you're under oath. I'm going to do that in front of the jury.
Sure.
Okay, just to let you know, I'm going to do that. Let's bring in the jury.
Yes, sir. Sure, is that right?
Hey, everyone, please be seated. Okay, members of the jury, I want to confirm while you were away, you did not discuss this case amongst yourselves, you did not do any investigation, and you received no information. Is that correct?
Yes.
I also want to confirm that and ensure that no one approached you about this case since we last were together. Is that correct?
Correct.
And that you have not seen any media coverage about this case since the last time we were together. Is that correct?
Correct.
Thank you very much. Mr. Anderson, you may continue your questioning, sir.
I'm back.
I know. Sticky too.
Before we broke, there was a series of questions concerning Maya's future care. And I'm allowed now to ask you about them, and I want to reference you to your report of January 22nd, 2017. And with the court's permission, I have it published here, previously discussed it. Can you go through this. You don't have to dwell on every one of them, but I want you to name off for the jury here the various treatments and the reason why they are reasonably medically necessary for Maya, given her aggravation from CRPS.
Same objection, Your Honor.
So, one of the things about treating CRPS is that I do is I know the definition is everything else has been ruled out. So the patient has severe excruciating pain and everything else has been ruled out by definition. That's the definition of CRPS. But I still look for a cause. Maybe there is something somebody missed, or there is something that I can find, and that would be obviously magical, because then if you know what's broken, we can fix it. So in her case, I looked for a condition called Ehlers-Danlos syndrome, or in brief, EDS. It's a kind of a benign condition where your joints are loose, you're hypermobile, and she had some features of that. Now, I wasn't sure about it because at that time, this was back then, there were no guidelines on how to diagnose this condition. It was actually in 2017, later on, that the guidelines came out on how to diagnose it. So I just put that there, that later on in the future in her life, she might ever want to explore that, she can do that.
Next one.
The next one was, I said that she meets the criteria for complex regional pain syndrome.
And then let's go to 3, as I think we've covered that.
So in number 3, I talked about a condition called tethered cord syndrome. And this is actually a condition common in children, and it is common in patients with Ehlers-Danlos syndrome. And in this case, what happens is that these patients their spinal cord is not hanging loose in their spine. It's tethered to the bottom of their spine. And it's a congenital condition, and oftentimes these patients can present with pain in both their legs. And it's a neurological condition, and it is diagnosed by a neurosurgeon. I also put that in there because maybe she has it, maybe we need to do a further workup, we don't know.
Okay. Can we go to the next one then? 4.
Are we going to magnify it?
Let's see. 1, 4. I don't need to cover
Okay.
that one. I was really interested in the CRPS treatment on the next page. Okay. Now, beginning in number 5, if you could go down and let me ask you the question. From 5 down through, I think then there's more on the next page. But these from 5 on down, are these reasonable and necessary medical condition treatments for Maya Kowalski based on the aggravation of her CRPS to a reasonable medical probability?
Yes, these are reasonably necessary, absolutely.
So let's give the jury an idea here of, we've talked about things that she can look into in case, but let's talk about what you think she should be doing or the treatment she should have.
Based on my
Your report, which is in evidence.
So on number 5, I put in there, recommend physical therapy for upper body strengthening exercises. So here's the thing. When she got her initial ketamine at Dr. Kirkpatrick's office, her upper body pain actually improved. The pain in her arms improved, but not the pain in the legs. And so, she was, when people use a walker, they need upper body strength because that's what they're supporting themselves on. They need to have stronger arms, stronger upper body. And so I said, all right, let's strengthen what we can strengthen, and at least so she can, hold the walker and walk. So that's what I said.
And how much, as she continues in life, should she reasonably expect to attend or go to a reasonable medical probability in order to minimize the effects of the aggravated CRPS?
Well, to minimize she has to completely avoid aggravating her CRPS.
Let's assume in life there is aggravations now and again. How is the physical therapy, should it be periodic, or should she continue to attend physical therapy throughout her life so long as she has the symptoms to a reasonable medical probability?
I need to clarify that.
Sure.
I actually said to hold off physical therapy for her legs.
Right.
Because you cannot do physical therapy on someone who has excruciating pain in their legs.
Right.
Okay, that's it.
So
for now, just strengthen the upper body, control the rest of her pain in her legs, which had been aggravated by her whole episode at the ACH, and then work on the legs.
Okay. As she has, and to a reasonable medical probability, is Maya going to have relapses from time to time of varying degrees and types?
Yes, she is. Okay, let's talk about the relapses for a second. This
Sure.
is not a joke. We're not talking about a relapse of a little headache. We are talking about severe. She lives at a baseline pain that you and I cannot even comprehend. Okay, that's baseline pain. Her brain has now changed enough that she is okay with that pain. When she has an exacerbation, it's horrible.
And are you aware, or has it come to your attention, that she has in fact had a relapse in November of 2020 that put her in the hospital?
Yes, I know that she did, and I don't know what happened. It may have been some sort of a stress. I know she didn't have an accident or a physical fall, but it could have been some stressful event that could have triggered that.
And her already having had a relapse some, 2.5 years, 3 years after getting out of Johns Hopkins, does that have an effect on your opinion that she may have more and longer and more aggravated relapses through her life?
Same objection here.
You can answer.
It's the same, it's the same analogy I gave you. If you have a wound on your arm and before it heals, you whack it and it breaks down, the skin breaks down again and the wound becomes worse again. And if you keep continuing doing that, one day it's never going to heal. One day you're going to be left with a really terrible open wound on your hand. And that's the same thing with this. If you keep aggravating her CRPS, her brain is finally going to alter itself. If it hasn't done it now, it is finally going to alter itself. That is that her CRPS will never ever go away. It never goes away. It gets we use the word remission, where it kind of comes down a little bit, enough that they can function.
And I believe you testified to this before, but just to tie it in, do you have an opinion based upon your background, training, and experience, and to a reasonable medical probability, if whether the timing and the intensity of what she experienced at Johns Hopkins over those 3.5 months aggravated that CRPS so as to cause her extra injury and damage?
Same objection.
Overruled, you can answer.
So, I need to give you the bigger picture on this.
Okay, go ahead. I just wanted to, yes, you do have an opinion or no?
You need to add $2 there. So, I'm going to make money today. So here we are, So we have a 10-year-old girl, and she's got CRPS in her legs. Okay, but her mom's frantically running around all over the country, from Chicago to Tampa, looking for treatment for her. Okay, she finally finds Dr. Kirkpatrick. He does ketamine on her. It helps her partially. It helps her arms. Okay, we got a little win there. But then he says, look, you need much more than what I can give you. So you need to go to Mexico and see Dr. Cantu, who's going to give you a ton of ketamine. And she does. And she comes back and she does well. Mm-hmm. And in fact, she does so well that Dr. Who's the doctor from?
Hannah or?
No, there's a doctor
Cantu?
from Johns Hopkins, the pulmonologist.
Oh, Kreisman.
Kreisman.
Dr. Kreisman.
Dr. Kreisman and her pediatrician said, this is not the same girl. This is a different girl. Her skin lesions were gone. She was a whole different girl. They both commented on that. And then, obviously, you can't afford treatment in Mexico that long. It's expensive. So she did the next best thing, was to go to Dr. Hannah, who tends to use higher doses. And so it was some sort of an agreement that she made. And she started to do ketamine with Dr. Hannah at somewhat higher doses. And she was doing great. There are videos of her swimming, running around, playing, doing great with physical therapy after Dr. Hannah's treatment. So you can see the progression that from a lower dose with Dr. Kirkpatrick to a higher dose to Dr. Cantu and then to Dr. Hannah, she is starting to make progress. Now she has this abdominal pain, goes to Johns Hopkins, and then everything goes down the drain. They don't believe her, they don't treat her stomach pain, they don't take care of her CRPS, they don't even, and she's been there dozens of times before, and now they treat her like they've never seen her before, they don't believe her, they stop all her treatments. And not only that, they mistreat her by keep touching her, keep handling her, and her CRPS flares up back to where it was.
So is that a yes? Johns Hopkins did aggravate her CRPS so as to cause her more damage and injury in the future?
Yes, very much.
And so let's continue down here. You've had, exercise and joint protection. I think you've talked about, avoid desensitization. Avoid desensitization, sensitization exercises. What's that about?
So, one of the theories in CRPS is that, all right, if because your arm is so sensitive, I'm just taking the arm. If your arm is so sensitive and if you have CRPS there and touching it makes it painful, we are going to touch it even more. We'll take a rough towel or a sponge or something like that and rub it even more so that your brain gets used to it. Okay, now that philosophy is actually counterproductive because do you remember how I said this morning that a barrage of pain signals, if I took a pen and I stuck it in my finger again and again, there would be a barrage of pain signals to my brain. And then the brain then alters itself. And it now takes over the pain. And this is what will happen when you do so-called desensitization exercises. If I take a rough towel and I start rubbing it on the area of CRPS, you are sending even more signals up there. There is zero literature. I am not kidding you. There is zero literature on the benefits of desensitization. I have searched it everywhere. I've asked people who do this. I said, where did you learn this from? Where is it? No one knows.
The non-responsiveness too.
So,
Hey, Doctor, why don't we wait for the next question and then you can answer?
You owe me $1 back.
oh, sorry.
No. The question then is, can you describe for the jury then with more specificity, is she going to have more of these relapses than she would have had she not been interrupted in her first round of care?
Yes.
Will they be more aggravated when she has them? That means more painful, more debilitating. And the third will they be in terms of length longer? So the three, again, are she's going to have more number.
How about one question at a time?
Yes, sir. You get my question?
Yes, to answer your question, yes, she'll have more frequent incidences of CRPS because the treatment that was initially working for her was interrupted.
And will those episodes be longer in length than they would have been, or will have any effect on that?
That's a slightly difficult question to answer.
Fair
Some will be longer and some may not be that long.
But can you tell us when she does have them, are they going to be more intense than they would have been had she completed the therapies that were in place?
Yes, every exacerbation she's going to have is going to be a lot more intense.
So she's going to have a lot more and more intense, but there's no way to tell the length of them.
Sustained unused.
It's just a summation. Okay. Now, well, we haven't finished this. Doctor, I don't want to take a whole lot of time because it's in the report, which is in evidence, and so you can read it. They can read it for themselves. But generally speaking, can you tell me? Can you tell us? I'm going to stick a step ahead here to number 10, gastroenterology, and why that's important.
So when I talked to her, and I went through every system, and when I got to the stomach, and I asked her, "Do you get bloating when you eat?" And she said, "Yes, absolutely, I do get bloating when I eat small amounts of food." And remember, she had already been to Johns Hopkins twice. I think, as long as I remember, it was twice for belly pain. And what happens as a complication of CRPS is the nervous system that controls the movement of your intestines. So your intestines move like a toothpaste, okay? So when you eat food, it moves along like a toothpaste. And that is controlled by a nervous system called the sympathetic nervous system. And that is affected in CRPS. And that was the reason her food was not moving, and obviously it was collecting, and she was starting to have all this abdominal pain, belly pain, and she was getting malnutrition because of it.
All right. Then is there a number 12 there, or have we reached the end? It says under 11A, it was minimized trauma. I think you've covered that. And then we go on the next page to continue on to the top, please. I think there's more. Go up. Here. Vitamin C exercise program, trial of graded motor imagery. What is that?
So there was a research that came out of Australia. It's actually accepted research modality for treatment of CRPS.
I'm going to sustain that objection.
What was the objection?
Bolster.
Oh, okay. Just tell us what graded motor imagery is, the basics.
It's in 3 parts, and the 3 parts I mentioned over there. It's a kind of an exercise you can do at home for people who have CRPS in one limb.
And then you said an echocardiogram. Is that periodic under number 12?
That's if she has Ehlers-Danlos syndrome, then an echocardiogram is a standard practice.
All right. And then, okay, positive results of physical therapy. So should she keep up physical therapy throughout her life as she's done?
Provided her pain is controlled.
Right. What about medications? Do you have an opinion based upon your background, training, experience, or reasonable medical probability if from time to time she would benefit from medication?
That's a difficult question to answer because her mother had tried a lot of medications, but that was a different time, and so we don't know if she can try them again. But she will need to try different medicines.
And with based on the assumption that the relapse occurred some 2.5 years after she got out of Johns Hopkins, do you have an opinion to a reasonable medical probability that the opinions you have offered here are equally applicable for this jury today?
Objection.
Can you rephrase that?
That wasn't a very good question. To a reasonable medical probability, is your report here in 2017 applicable today, these different treatments and future medical care?
Yes.
So, just a couple last questions. I think the jury will hear at some point about intrathecal pumps and Beata Kowalski's request, or just asking about it in theory. But what is an intrathecal pump, and is this some boogeyman that we should be afraid of?
Object to the compound.
All right.
Why don't we just go what is
Yeah,
What
no
is the pump?
Boogeyman, sorry. Intrathecal pump simply means a pump in the spine. So the principle is actually amazing. And I'll give you an example. If a person needs, say, 10 milligram, needs morphine, 10 milligram pill for their pain by mouth, 10 milligrams by mouth. If you give the same morphine into their spine, they'll only need 1 milligram, which means they need lower doses. It is far more effective because you're hitting the pain at the source, and you're also not seeing any side effects. So intrathecal is in straight language, it means spinal pump.
And from your experience with mothers and fathers of children with this extreme pain, do you find it in any way unusual or odd that she would question whether the intrathecal pump would be appropriate for Maya?
Yes, it is an appropriate request. I thought it was an amazing request that she made it, because she's trying to decrease the dose of drugs that Maya is getting.
All right. And finally, is ketamine FDA approved for children?
Yes, it's used all the time for children.
And is it now FDA approved as what's known as an orphan drug?
Yes, it is.
And what is an orphan drug?
So actually the sentence should be, is it approved as an orphan drug for CRPS?
For our CRPS, my apologies.
Yes. And so, there are some diseases that, like the FDA has these rules, okay? Like they might say, somebody with migraines, we need, 1 million patients. We need you to test this drug on 1 million
Objection
patients.
to hearsay on the FDA rules.
Well, I'm just trying to explain.
You can answer that one.
You can answer.
But in some diseases that are not that common, they can't get 1 million patients with CRPS. So the FDA says, all right, we let you do it with 400 patients. And that's called an orphan drug use. So they kind of make it, they're not all diseases are that common. And some diseases that are not common, they put them down as orphan drug use.
Is that because of the expense of doing a full trials?
No, it's because they can't find that many people.
Okay. And I have to ask you one last question on liability here. And do you have an opinion based upon your background, training, and experience into a reasonable medical probability from everything you've seen here, whether the doctors comprising the Johns Hopkins pain management team, that is Laura Vos, Richard Elliott, Amish Patel, and nurse Ashley Sumner, breached a duty of reasonable care by deviating from the accepted standard of care insofar as the care and treatment of Maya Kowalski?
Same
Yes.
Overruled. The answer stands.
And can you tell us to a reasonable degree of medical probability based upon your background, training, and experience whether that was a cause of this aggravation and this future we now know about for Maya?
Can you explain that a little bit more?
Sure. I want to know whether when you answered about they breached a duty of reasonable care, was that breach a cause of the damage and injury to Maya?
Yes, it was.
And is that to a reasonable medical probability?
Yes.
Your witness?
Mr. Shapiro.
Good afternoon.
Good afternoon.
Were you aware that Beata Kowalski chose you?
No, I had no idea.
First time you're learning about that today?
This is the first time I'm hearing this.
Okay. You're not an emergency physician, correct?
No,
You're not board certified in pediatric anesthesiology either.
no,
You, in terms of hospital privileges, you haven't had any in more than 20 years, right?
I chose not to.
Okay. You don't treat patients in hospitals.
I don't have the time to go to hospital.
Okay. In terms of your fees to be here, what are you charging?
Sorry, could you?
What do you charge to be here?
Oh, so far they've been kind enough to pay for my hotel. The rest I have no idea.
Okay. You haven't sent a bill to Mr. Anderson yet for your time?
No, I haven't.
Okay. Do you know what it will be, or you haven't tallied it?
I have no idea. My office handles that. I don't handle that.
Okay. I know you don't know the amount, but just so it's clear, Mr. Anderson, his office is paying you to be here today and for your review. Is that fair?
They're paying for my time.
Okay. Let me ask you about ketamine. You told the jury a moment ago about FDA approval. Back when Maya was getting ketamine in 2017, ketamine was not approved by the FDA for CRPS. True?
Well, yes,
That's true.
that's true.
Okay. I want to talk to you a little bit about your statement that Maya was improving before she went to All Children's in October of 2017. You base that on your review of Dr. Honda's records, right?
Actually, I base that not just on his records, but also on videos.
Okay. Well, let me see if I can narrow down a time frame here. Clay, will you put up what's in evidence as Joint Exhibit 1040-206? And you can enlarge this. I will represent to you, we can go to, this is a signed letter from Dr. Hanna dated September 25th, 2016. Do you see that?
Yes.
I'll represent to you that this was written by Dr. Hanna to the school district to explain homebound status. And I'm going to ask you about some of the statements in here to see if this is consistent with what you're telling the jury in terms of how Maya was actually doing before she went to my client's hospital. At the top it says, Maya suffers from horrific disease, RSD, CRPS. Do you see that?
Yes.
Your testimony to this jury is before Maya ever went to my client's hospital, she had debilitating CRPS. That's what you believe, correct?
Yes.
And as a result of her debilitating, horrible CRPS, she was going to require, in your mind, a lifetime of care. True?
Yes.
Okay. Now, reading down on this, it says on September 6, 2016, evening time, Maya had a relapse of her RSD. Maya became overstressed, extremely worried, and crying after a September 6, 2016 individual education plan meeting at Taylor Ranch School, which I strongly believe led to her RSD relapse. Do you see that?
Yes.
Okay. Did you know, and maybe you didn't, but did you know what caused this alleged relapse of RSD?
Well, it says right here,
Okay.
after the IEP meeting.
So, at least from your understanding reading this record, there was a psychological stress on Maya that you would attribute to the relapse of RSD. Is that fair?
A stressful event at the IEP meeting.
According to this letter, Maya was then complaining of severe pain to her legs, 10 out of 10. True?
True.
She was complaining of severe pain to her back, 10 out of 10, true.
True.
She was complaining of severe pain to her arms, 9 out of 10, true.
True.
Severe pain to her stomach, 9 out of 10, true.
True.
Migraine pain, 10 out of 10, correct?
Correct.
Severe weakness, nausea, and vomiting, and was unable to eat or drink fluids for 3.5 days, leading to her dehydration. True?
True.
And all of that was a couple weeks before she entered Johns Hopkins All Children's Hospital on October 6th, correct? October 7th, I apologize.
Yes.
This was her condition. And in addition, because you were telling the jury how well she was doing, I want to make sure that you understand this letter. Maya also required daily IV fluids for hydration leading up to her hospitalization at All Children's. True?
Well, this needs clarification. You can't just say true.
Well, do you have any reason to dispute what Dr. Hanna wrote to the school board saying that starting on September 6, 2016, Maya, on a letter dated September 25th, so now 3 weeks later, that Maya was requiring IV fluids for hydration? Do you have any reason to dispute this?
No, I have reason to dispute a lot of this letter because, you see, she was doing well, and then she had this IEP meeting on 9/6/16, and obviously that was a stressful meeting, and she went down. Everything, her condition got worse. Now that's a feature of CRPS.
But my point, doctor, is she never got better between this September 9th, 2016 relapse that you're claiming is a relapse of CRPS until she went to All Children's on October 7th. You recognize that, right?
No, I don't. How do you know that she didn't get better?
All right, let me show you the next record. Well, before we move on to this, the second last sentence says, as of September 15th, 2016, Maya K's RSD relapsed, and she has not returned to her usual baseline where she used to be prior. Do you see that?
When she used to be prior to 9/6/16. Okay, yeah, I do see that.
Okay, so now let me ask you about what's Joint Exhibit 1040-20. This is in evidence Dr. Hanna's records. Joint Exhibit 1040/20. And if you can zoom in to the top on the date, this is October 5th. So now, if you want to clarify whether Maya was better before she walked into the hospital, I'll represent to you, this is now 2 days before Dr. Hanna asked her to be admitted to All Children's. So let's scroll down a little bit more. Do you see on the history of present illness in capital letters, patient stated that her weekend was rough and she didn't sleep due to pain and had a great deal of nausea and vomiting. Do you see that?
Yes, I do see it.
And on the weight chart, 2 days before she went to All Children, she was 60 pounds. That's the 5th percentile. True?
Yes.
And her height was below the 1st percentile. Do you see that?
Yes.
Do you know from your review of the records that Dr. Hanna then infused 1,250 milligrams of ketamine?
This was the day before she went to,
2 days before.
2 days before she went to All Children's.
Correct.
Yes, I know that.
Do you actually know that she underwent 5 ketamine infusions in the days leading up to going to All Children's?
Yes.
Okay. Let me ask you, Clay, if you'll turn to Joint Exhibit 1040/233. Were you aware that Dr. Hanna had his patient Maya fill out how she was feeling in her overall, what they call quality of life survey?
Okay, so I'm not just going to say yes to this.
Well, let me ask you this, and then if you need to explain, you can. You're aware of something called the American Chronic Pain Association Quality of Life Scale, correct? correct?
Again, this is not an accepted quality of life scale.
Okay. Well,
This is by an association that doesn't mean anything.
okay. Well, the question, you can see there's 0 through 10, where they're asking Maya, how are you feeling, with 10 being go to work, volunteer each day, normal daily activities each day, have a social life outside work, take on an active part of family life. That would be 10, normal. 0 is stay in bed all day, feel hopeless and helpless about life. Were you aware that 2 days before Maya went to All Children's, her function was 0, according to the survey? Were you aware of that?
Right, and that's expected of it. A 10-year-old child with excruciating pain everywhere is going to be, she doesn't see anything left in her life because she's in excruciating pain all the time.
Let me ask you about Joint Exhibit 1040/17. Were you aware that even after this, Maya went back to Dr. Hanna the next day for a large IV ketamine infusion? Were you aware of it?
Which date is that?
This is October 6, 2016, the day before she was admitted to All Children's. Were you aware she was up in Clearwater getting a ketamine infusion from Dr. Hanna?
Well, I do see the record, so I'm sure she did.
Okay. And in fact, at least the time of the record is 3:40 p.m. I'll represent to you she was admitted to All Children's the next morning. But according to the record, again, it says on the history and physical, patient and mother state patient is still in extreme pain. Do you see that?
Yes.
And then, Clay, I'll ask you to go to Joint Exhibit 1040/225. This is the quality of life survey filled out the day before she went to All Children's. It was 0 again, wasn't it, doctor?
That 0 is going to be there for a long, long time.
You expected this 0 to be there for months, didn't you?
Listen, if you have the world's worst excruciating pain and you're a 10-year-old kid, let alone if you had it in one leg, you would be still 0. She had it in 4 limbs. She is always going to mark that 0 at that point.
But certainly what you're telling this jury, it sounds like, is based on her condition the day before All Children's, Maya was going to be sick with crippling pain for a while, correct?
She's going to be sick with crippling pain for most of her life.
Right, including through her hospitalization at All Children's. That's what you think. Not because of what All Children's did, because that's her condition. Correct?
Right, and she did not respond to the ketamine that given to her 2 days before that, and then she had abdominal pain. And that was the reason she went to All Children's.
Because the ketamine failed, correct? The ketamine...
That episode failed.
Okay, let me next ask you about some of the things that went on in the hospital. And before I do, let me just ask you this. You use ketamine. You do not, in your practice, recommend ketamine comas, true?
I don't do ketamine coma in my practice.
Okay. You don't do hyperbaric oxygen therapy?
No, I don't.
You don't do oral ketamine?
I do sublingual ketamine, which is under the tongue. You put this ketamine under the tongue. You don't swallow the pill.
You don't drink oral ketamine with Gatorade for your patients, do you? You don't have ketamine mixed with Gatorade and have the patient drink it at home, do you?
I don't believe in oral ketamine.
Okay. Let me ask you, before we move on to what happened in the hospital, you do recognize there is authoritative literature in the field of ketamine infusion, true?
Objection.
There is a what of literature?
Hold on a second, doctor. What's the legal basis?
Improper impeachment regarding literature.
Well, I'm asking him if he can, so I'll rephrase the question. For infusion of IV ketamine for CRPS, are you aware of consensus guidelines?
Yes.
And do you consider those guidelines authoritative in your field?
I'm sorry, consider what?
Do you consider those guidelines authoritative in your field?
No.
Okay. Do you remember when I took your deposition on February 25th, 2022? I'll hand you a copy. I'm going to ask you to turn to page 37. If I may approach it.
You may.
Sure.
This is a copy of your deposition that I took.
Page 37.
Yes, page 37. And on line 15, I asked you, for the infusion of IV ketamine for CRPS, are you aware of any consensus guidelines? And your answer is yes, there is one. And I asked you, do you consider it authoritative in your field? You said yes. Well, it is authoritative.
Well, I wasn't referring to the one you're referring to. You're referring to Stephen Cohen's.
The one attached to your deposition. I asked you, was that authoritative? And we marked as Exhibit 9 to your deposition. Are you saying you no longer recognize it as authoritative?
What's attached to my deposition?
I'll hand you the article.
Huh?
We're talking about the one authored by Dr. Stephen Cohen, correct?
You're talking about that, not me.
Okay. When I showed you Stephen Cohen's article in your deposition, you told me it was authoritative per your testimony, did you not?
I don't recall seeing Stephen Cohen's, because I've never believed in those guidelines.
Okay. Well, let me ask you about some of the care that went on at All Children's. You were aware, well, let me just ask you about, you reviewed the records from All Children's, true?
Yeah, 7,000 pages.
Okay. Let me ask you about Joint Exhibit 1001-2718. At the bottom where it says result comments R46, the second paragraph, did you review this record? Patient also stated in the room with me that she hasn't eaten in 5 days. I asked her if she doesn't have an appetite, and she said she can't eat because she's not allowed. Did you review that record?
Listen, there were 7,000 pages, so I can't tell you whether I reviewed it or not. But I agree that this is, if you're showing it to me and you tell me this is from them, yes.
Let me ask you about Joint Exhibit 1001-3746.
Objection, Your Honor. Improper impeachment. He's not reading the second sentence right there that explains it.
Overruled. You can continue.
On Joint Exhibit 1001-3746, at the bottom, were you aware in reviewing the records that Mrs. Kowalski refused to have her child evaluated by psychiatry on admission? Were you aware of it?
Oh, yes, and I'm not surprised.
Okay. Were you also?
That's very appropriate.
Were you that you? So what you're telling this jury is you don't believe that Maya should have ever been assessed by a psychologist. True?
True, absolutely.
Okay, so let me ask you about her time in the hospital. Were you aware in reviewing the records that All Children's Hospital tried to transfer Maya to a comprehensive program for CRPS, but the parents refused?
Objection. No. There's no facts in evidence on any of that.
Okay, let me direct you to Joint Exhibit 1001-1765. Under projected discharge planning needs about halfway down, placement, and I'll represent to you this is November 10th, inpatient rehabilitation care, court order pending, parents declining to sign consent at this time. And then under provision of care, it says mother continues to deny consent for inpatient treatment at Nemours. Were you aware of that?
What's the question?
My question is, you've been critical of the care Maya received at All Children's. All Children's was trying to transfer her to a comprehensive center for,
Objection, this is
he asked me
not in
to,
evidence. None of these documents are in evidence.
this is the joint exhibit from All Children's.
Time out. Gentlemen, if you could approach. The question is sustained, but you may continue, Mr. Shapiro.
Thank you, Your Honor. Doctor, were you aware during Maya's hospitalization that the parents declined to have her transferred to another hospital for care?
But
Were you aware of it?
well, yes, according to what you're showing me on the document, yes. But I need to elaborate why they refused.
Okay. Well, you're welcome to when Mr. Anderson asks you questions.
Actually, you can answer.
Okay, go ahead.
Finish the answer now.
Yeah.
Go ahead.
Well, because the idea of treating CRPS is first you've got to control the pain. You can't have a patient with severe burning pain in 4 limbs and you put them into an inpatient rehab center and start making them exercise. So ACH was not doing anything to help her pain. And so they need to control her pain, and then they would have transferred her to any other place they could. She was doing rehab anyway. She was even doing rehab at ACH.
Are you telling this jury that in your review of all the All Children's records, they never offered Maya anything for pain?
Not enough.
They offered Maya pain medication during her hospitalization. You know that.
But they didn't control the pain.
You are aware that, or are you aware whether there were attempts to transfer her for outpatient therapy? Are you aware?
Same objection.
I'm sorry, could you rephrase that question?
Are you aware of whether All Children's attempted to transfer or discharge Maya earlier in her hospitalization for outpatient therapy?
Well, I mean, you're not getting my point. My point is that All Children's did not control her pain. And now they're trying to pass her off to an inpatient rehab or an outpatient rehab or something like that. That's what they're doing. And the parents didn't want that. The parents wanted her pain controlled, and they would have done the rehab happily by themselves. They were doing it at Dr. Hanna's place.
And we talked about Dr. Hanna's records and their success rate, but let me ask you about your evaluation of Maya. in your report. By the way, the recommendations you made in your, well, let me just back up. I apologize, doctor. You've seen Maya once for a forensic evaluation in January of 2017, correct?
Yes.
You have not evaluated her since, true?
No.
Okay. You sat with her for 5 hours and 22 minutes?
That's correct.
What pain medication did you give her for your evaluation?
No, it's just an evaluation, not a treatment.
Okay. She was able to tolerate your evaluation without any pain medication.
She wasn't. She was in severe pain.
She sat with you for 5 hours and 22 minutes, true?
She lay down. She didn't sit.
Let me ask you about some of your statements for plans of care. And actually, let me, I think this is Joint Exhibit 2005-1. Clay, if you don't mind putting it up on the screen, please. Well, I may have the wrong exhibit. It's there we go. I think this is what Mr. Anderson walked you through. True?
Yes, he did.
Okay. The way, and it's just a technicality, but I thought it was important to point out, so let me just ask you. This report that you have was actually a letter back to her primary care pediatrician, Dr. Wassenaar, true?
Yes.
Did you ever speak with Dr. Wassenaar?
No.
Let me ask you about some of the recommendations in your report. By the way, at this point, Maya hadn't walked in almost 2 years, true?
I don't remember that.
Okay.
For how long she hadn't walked.
I'm not trying to trap you, I promise. The testimony that the jury's heard is generally that after about July 4th, 2015, she was in a wheelchair from that point going forward. And if I got that wrong, I'm sure someone's going to jump up and tell me. But all that being said, so now we're 2015, 2016, so about a year and a half, she has not been out of her wheelchair walking, okay?
Okay.
Would the lack of walking secondary to what you believe is CRPS cause her legs to be atrophied?
Yes.
Let me ask you about some of the recommendations that you were talking about with Mr. Anderson that begin, I think, on page 18. It could be 19. That's it. All of these recommendations are because Maya has CRPS, true?
No.
Well, I guess that's fair. Some of these are because you think she may have had Ehlers-Danlos syndrome, true?
Right.
That's a genetic disease.
Yes.
Did you test for it?
I did a clinical. There's no blood test for it. It's a clinical test.
Okay. Do you know if Dr. Wassenaar ever followed up on your letter to him recommending treatment for Ehlers-Danlos syndrome?
My job was very clear. The question I was asked was, does she have CRPS or not? And
So-
that was my job. My job was, I wasn't a treating physician.
I understand. You were serving as a forensic expert on this issue, true?
True.
Okay. But you did, in your evaluation of Maya, believe she may have had a genetic cause for some of her problems, true?
Could be.
And you also thought that she may have had a neurologic cause in the form of a tethered cord unrelated to CRPS.
I wasn't sure. I needed her to see a neurosurgeon to decide that.
Do you know if Dr. Wassenaar ever followed up with a neurosurgeon?
I don't know.
You also, in your report, if you go down a little bit on the same page, talked about bilateral thoracic outlet syndrome. Do you know if any follow-up was ever done for Maya regarding that?
We've already established that this was my one and only contact with Maya, and it is a forensic exam, so I'm not the treating physician. I don't follow up.
Okay. Then I promise you I won't belabor the question. The answer to any question I ask you of, do you know if Dr. Wassenauer ever followed up with this, any of this, the answer would be you don't know.
No, I don't know.
And in terms of her complex regional pain syndrome number 11, it says minimize surgical trauma. At the bottom, 11A. Minimize surgical trauma, including needle sticks. Okay. It was your belief at that time that Maya's CRPS was so bad that for the going forward, she wouldn't be able to tolerate needle sticks. Is that true?
No, that's not what the recommendation means.
Okay, so and let me try to clarify. I appreciate that. In terms of what you're telling this jury, you don't know in the future whether Maya is going to have this problem because you haven't evaluated her. True?
We know she has CRPS. So this rule applies to her for the rest of her life. So a person can have CRPS in their left leg and they still are at risk if they get a needle stick in their right arm.
Piercings. She'd be at risk if she got piercings.
That is the risk.
Okay. Do you know if Maya ever got piercings?
No, I don't know.
Do you know if she got piercings, whether she had any pain from them?
I don't know.
Okay. Do you know if she's had any subsequent surgeries where she's had any problems as a result of surgery, or you don't know?
So that's not how the human body works. So if you have CRPS and you get a piercing or you get a surgery, the chance of your CRPS getting worse or spreading is high, but doesn't mean that it will get high or it will spread.
So what you're telling this jury, you're not saying that these things on her list are more likely than not to happen. You're just saying that these things on your list are things that somebody, for example, with CRPS might encounter. Is that fair?
It's a,
vague.
overall,
14 of them.
it's a standard recommendation for any patient with CRPS.
Got it. The recommendations on here are standard for anyone who has this diagnosis. True.
Recommendation 11A.
Okay. The just a couple more questions, Doc. Well, let me ask you a little bit about. You don't know how. I mean, I know she's in the courtroom, but you don't know physically how Maya's doing today. True.
No.
Okay, but you can tell physically she's doing better today than she was when she was brought into All Children's. True?
Well, first I didn't see her when she went to All Children's, and today all I've done is see her from a distance. That doesn't mean that she can't be in severe excruciating pain.
Has anybody, have you, in your time working on this case and working with Mr. Anderson, did you ever ask Mr. Anderson, how is Maya doing today?
No.
And when she saw you, she was in a wheelchair, right?
Yes.
And now she's walking today.
Yes.
One moment, please. I don't have anything else further this time, Your Honor.
Maybe we put one exhibit on.
Sure.
the jury, my conference is going to take a few more minutes, so what I'm going to do is I'm going to send you for a short break. Let's try to keep it 5 minutes or so. Do not discuss this case amongst yourselves. Do not do any investigation and receive no information. Let's try to keep it to 5, maybe 10 minutes, okay?
All right, for the next thing.
Okay, the jury is out of our presence. Everyone, please be seated. Mr. Shapiro, Mr. Anderson, does Dr. Chopra need to step outside, or can he sit here while you do what you need to do?
It's up to Dr. Chopra. If he wants a break, I have no objection.
Do you want a couple-minute break, sir?
Yeah.
Okay, why don't you come back in 5 minutes? Just remember, you can't talk to anybody about your testimony. Just so the clerk's aware, we're now talking about Exhibit 3035 and perhaps certain pages, including 0024. And we're going to wait on Mr. Shapiro to give us additional pages to look at.
Thank you.
Do you want me to sit here, or do you want me to come back in 5 minutes?
You're welcome to come back in 5 minutes. Sir.
Okay, I'll be back in 5 minutes.
just looking, they just handed me the documents they want to put in.
Okay, go ahead and review and let me know if there is any objection.
This is still confidential.
Right. I mean, we don't need you at sidebar at this point. What are the, is there an agreement or are there objections?
There are objections, not to the complete document, but there's objections to the introduction of explanations of court hearings, court strategy, and the DCF.
Time out. Just tell me specifically what pages we're talking about. In Exhibit 3035.
3035-12 would be one of the ones that if we're going to go into this with this witness, I would want recross on.
12, and then what are the others?
3035-22 and 3035-23.
Okay, so can someone put up 12, 3035-12? And what is the objection, Mr. Anderson?
I think these are together, but if you look down under 3 p.m., Kathy stated parents are still in court reviewing patient's case with judge, and they do not anticipate meeting will conclude before 5 p.m. And my concern with this, Your Honor, is that I don't know what this witness is going to say once they open the door to the DCF matter, because I have not briefed him or prepped him so he knows the rules. And so when we get into the DCF stuff, I think it's going to be the Wild Wild West. And this is loaded with it, including, if you see the next page, Judge would like appointment to be scheduled sometime tomorrow morning. We're going to be starting to try the DCF case too. So if you look at the next page, it's more clear.
Page 22.
Yes. So
This part.
yeah, CPS has been contacted and is going to come to All Children's this afternoon to begin their investigation. I thought that what's the date of that? I thought that was out of evidence in terms of being used for cross-examination, but
Well, here's where I'm at right now, Mr. Anderson. Again, this is all predicated on what you're going to do with this witness. If I already told you, if you wanted to go into 3035-0024 with this witness, I'm going to let you do it. But so far, and these other documents will probably come in so far. I mean, and yeah, there's some things in here that I'd rather not be, but the Nemours issue probably is going to have to get explained somehow to the jury anyway.
well, it's fairly complex. And again, what happens if the witness who doesn't hear anything, doesn't know anything, starts telling what he knows about the DCF investigation, how unfair it was, all of the different things that we're alleging. I don't know what his knowledge is on that, Judge. And so it's very likely, I think, that we're going to get a lot more. This particular point here that they're trying to raise, I think, can be covered in other ways. But the main thrust of this is that they're getting DCF involved. It's the 9th. It's 2 days after they came in.
Well, again, this is predicated on what you're going to do. And, I'm not going to tell you how to try your case. It sounds like you don't need this witness to talk about the issue that you want to talk about. But, hey, if you feel like you want this witness to make those comments, then I'm going to let you address the 0024 document. But on cross-examination, then I'm going to let them address at least 12 and 22. I haven't looked at 23 yet. So if you don't go there, then we don't need to make any rulings. If you do, then we will. So it's up to you.
My biggest concern is I was hoping to have a couple extra hours this afternoon, which are rapidly evaporating. If they're just going to use those two, fine.
Well, there's a third one. I didn't look at
I haven't
23.
seen the third one either.
Would be potentially 303523. No, that's one. You don't want. No, that's one. Okay, I guess not that one then.
Not 23?
We'll take that one.
Yeah.
I beg your pardon.
We'll take 23.
Yeah, 303523 would be a potential.
Yeah, we'll
Okay,
take 23.
Put 23 back
Get
up,
those
please.
printed out somehow.
Yeah, we'll take 23 as well.
I'd like to use a highlighter. We're kind of on a spur of the moment here. Do we have the ability to?
Okay, so let me be clear that because I'm going to allow 3035-24, we're also going to allow in 12, 22, and 23. Is that correct?
That appears to be it.
Mr. Shapiro, do you agree?
If I just get a proffer from the plaintiff of exactly what he plans to ask the doctor, only because the doctor said he doesn't know anything about the Moors. And so I'm trying to get a sense of how deep this is about to go and how we're responsible.
Well,
Because
let's-
obviously we don't want to open up.
Let's bring in the doctor, put him on the stand, and see what happens
Okay.
outside the presence of the jury. Yes. Doctor, what we're going to do is we're going to ask you some questions outside the presence of the jury, and then we may or may not ask them again in front of the jury. That's fine. Mr. Anderson.
May it please the court. Doctor, in your files, do you have the Nemours Hospital records? Do you know?
I don't think I have them. I'm not 100% sure.
Okay. If I showed you a particular Nemours document, then in evidence, do you think you can identify this as a Nemours transfer notice? Let me show. May I show it to him?
Let's just put it on the screen.
Let's put him on.
My impression was that Nemours refused admission.
Exactly, but we're talking now about the reasons why.
And when you say put this document, you mean 3035-0024?
Yes, sir.
Can I have one of the IT folks put it up, please?
If you could read that, Doctor.
So this is just to save time, this is a evaluation report on Maya?
This was a Nemours order for the transfer of Maya Kowalski and the reasons that it was rejected ultimately. And I wanted to ask you a question. I know I'm in the interest of time. Assume Jack and Beata Kowalski had researched and determined that Nemours does not have a comprehensive CRPS program.
I object to this. This,
We don't have a jury. Let's get the information out first. Then you can talk to us about your objections. Now, again, Mr. Anderson, let's not make predicate statements. Let's just ask the questions.
Yes, sir. Assume Jack and Beata Kowalski had researched and determined that Nemours did not have a comprehensive CRPS inpatient program. And assume further that the research revealed that it would be more of the PT that she had been through about 4 times. Assume further that from this form, as you can read, that the transfer to Nemours was based in part on Munchausen's by proxy assigned by Dr. Dees, who is not a psychiatrist or psychologist, let the record reflect. It says right there, pediatric hospitalist. And so, do you have an opinion, assuming those facts, as to whether the actions of Jack and Beata Kowalski in rejecting the Johns Hopkins reasons and methods of transferring Maya to Nemours in Orlando?
I object to that question.
We're in Proffer.
I'm allowed to object before this. My objection is multiple. It's the court asked the plaintiff not to give a predicate, and then he just gave 6 predicates. But in addition to that, he's asking now the plaintiff to speculate on the state of mind of the parents. He's not disclosed as an expert on either and judge the reasonableness of their conduct.
Okay. Well, one thing I heard is you're now asking him an opinion. It sounds like this opinion wasn't disclosed. Is that correct?
He had no opinion about transfer unavailability.
Well, they were going to, I'm sure, open that door. I felt like they did on their cross. That's why I stood up.
Well, they opened up the door about Nemours. That doesn't mean this witness can give opinions that hadn't been previously addressed or disclosed.
I would. I can't remember the specific 2 or 3 questions, but my memory is that the questions were designed to give the jury the impression that somehow the Kowalskis had misbehaved or done something wrong in rejecting the Nemours transfer. That was clearly the thrust of them. To me, that opens the door for me to point out that they turned it down because it was based on, in part, Munchausen's by proxy, and I believe one of these codes here is from conversion disorder for Maya.
Why isn't this testimony from Mr. Kowalski?
It can be, but I think...
To me, I didn't realize you were going to ask him an opinion that had not been disclosed. So on that basis, no, this witness can't testify to an undisclosed opinion.
Well, can he testify to anything having to do with his experience and the narrative provided affecting the treatment of the child and the family?
I don't understand your question.
Can I show him this? And he's obviously aware of the prior questioning, and ask him whether his experience would be that this transfer notice being signed by the Kowalskis, is it...
Time out. Sir, do you know anything about the possible transfer to Nemours?
All I know is that Nemours refused to transfer.
Okay. How did you come to that information?
It's somewhere in the records. That's the only way I would have known.
Do you know any of the details as to why the transfer was refused?
there was no details, but can I just put in something?
Sure.
If I were, as a physician, and with 30 years of experience, if I saw the word Munchausen by proxy, I don't want that patient.
Okay. Anything else?
That would probably be a pretty good question, if allowed. Having seen the Nemours transfer notice, would you, as a physician, want to accept the patient? The answer, I gather, is no. And then I would ask him why.
I'm going to object to that as an undisclosed opinion. My questions to him about transfer were very specific to malpractice claims, meaning there was an allegation from Dr. Chopra that my client committed malpractice and not giving her the proper therapy. The only reason I was asking about transfer is part of the defense of that is all Children's tried to make a transfer of the patient to a center in Nemours that specializes in comprehensive regional pain syndrome and in the rehabilitation of that, and that was not consented to. It had nothing to do with his state of mind about whether a mom should want to purely as a defense of a malpractice claim, that very narrow issue.
Well, here's where I'm at. The issue of Nemours, I think the defense has opened that door. And you're going to be able to call whatever witness or witnesses to explain. It doesn't sound like, other than seeing some sort of reference in the records, he really has details as to what happened or didn't happen with respect to the proposed transfer. And so I don't think this is the witness for you to go into that.
I have a possible solution then. I'm happy to not go into this with this witness. If the court enters an instruction that strikes the three questions about the transfer to Nemours because they were asked before it was put into evidence.
Yeah, but there was testimony about it 2 days ago as well. So it's...
I probably objected at that time too.
I don't recall. I really don't recall.
Well, our problem is this, Judge. If we're going into this, the jury should not be left hanging with this impression that Beata and Jack were being unreasonable. We have a right to rehabilitate, or whatever you want to call it, by pointing out that if they sign this, they're signing on to agreeing to Munchausen by proxy, among other things. And it's just not fair to our side that if the jury hears one side of that story, they won't hear the other side.
And again, I have said that you can call witnesses because the door has been opened. The reality is, I'm not going to allow in an undisclosed opinion. I think that's pretty clear. And it sounds like you're now trying to get him to make assumptions or assume a hypothetical to give an opinion that he has not previously given prior to today. And it's no issue with Dr. Chopra because I don't think this was something that was ever asked of him. So, I told you earlier, if you're going to want to show this record, that's fine, but you can't ask him opinions that were undisclosed. And once you show that document, we're showing the other documents that we were talking about. So,
well, it really puts me in a dilemma here, and it's not a dilemma of my making. And the defense was allowed to ask questions of for a witness for documents that were not in evidence, thus leaving the jury with a certain impression. So if
Mr. Anderson, I just need you to decide.
Can we have 1 moment, Your Honor?
Well,
Literally 30 seconds.
Dr. Chopra, I'm showing you Exhibit 3035-0024. Do you have it in front of you?
Yes.
And does there appear to be a series of diagnoses in the middle of the page by a Dr. Dees, a pediatric hospitalist?
Yes.
And is one of the diagnoses assigned by Dr. Dees Munchausen by proxy?
Yes.
if you turn the page, is there?
I can't turn it. Somebody else will.
That's all right. But there's a second page for a place to sign, which we'll bring up. And that's all I'll ask you. Was there a place where the Kowalskis were supposed to sign to agree to this for transfer? That's my own. Those are three factual questions.
There's no place for the patient or the patient's representative to sign.
Well, it says E level, encounter E level signatures, order level documents, and so forth. It's kind of in bureaucratese, but this is, I believe, what they were presented with.
He gave his answer.
All right, so I don't ask him about the signature page.
I don't know what encounter level e-signature means.
E-signature is one that's sent through the court. Yes.
He doesn't know.
Okay.
So
I
I'm
can
not going
ask
to
you.
tell him for him to turn around and say it. So
Well, I understand, Judge.
Thank you.
I'd like to ask the factual questions here because I don't want the jury left with that impression. And it could be 4 or 5 days before we call Jack Kowalski.
If I understand, Mr. Anderson wants to address with Dr. Chopra the reasonableness of accepting transfer with a diagnosis of Munchausen in the record as an undisclosed opinion.
I think at this point it's just the last 3 or 4 questions, the factual questions he asked about the document.
And the problem with that is the redirect, if the implication, I don't think this is a secret, if the implication is going to be that we would have accepted a transfer except now that there's a diagnosis in the record, it's going to open up a redirect on the fact that it was also in the record in 40 other medical records and providers from Lurie's to et cetera. And I don't know how much of this I need to get in front of this witness. It's just
That's a difference between a diagnosis and a theory.
Here's where I'm at. Those questions that you just asked Mr. Anderson, except for the parent signature question, I'm fine, and I'm fine with the 0024 and 25. But if you go there, I'm going to allow 12, 22, and 23 as well. So I just need you to decide right here, right now, whether you're going to use this witness to do it, have this discussion, or you're going to call someone else down the road. And I know you feel like you're in a box, but at this point in time, you got to make a decision.
Well, over my objection, I probably at this point will hold off, with the document. But I will ask questions about the basis for the transfer. Does he know the basis for the transfer in part was Munchausen by proxy?
Okay.
Is that okay?
If you're basically now going to ask him questions off of this document, I see that as the same thing as us introducing and showing the jury the document. So,
That's pretty much the way I felt when on their
Mr.
cross-examination.
Anderson, we are where we're at. Do you want to use this witness to talk about the Nemours issue as I just outlined, or are you not?
One moment.
I've got a jury waiting.
I don't know. It's very difficult. One more question of him, and then
In proffer or
Proffer.
outside or with the jury?
Proffer.
Okay.
Are you able to identify this as a transfer form as opposed to something else?
This is a report of an admitting nurse from Nemours.
Okay. And can you see from this document why we have an admitting nurse at Nemours giving this report?
Yeah, I would object to the speculation.
You can answer the question. Sir, do you know the answer?
If you don't know,
What's
you
the
don't
question?
know. Yeah, the
Sorry.
question is, do you know why, and at this juncture, a transfer nurse was involved?
Well, yes, that I know. All children wanted to transfer Maya to Nemours
All right.
for rehabilitation.
And then what does the diagnosis in part show as a reason assigned by Dr. Dees to transfer her over?
It shows Munchausen by proxy.
And in your opinion, did this child have Munchausen by proxy? That is in the report and in the record.
Absolutely not.
Right. I'll use it.
Anything before I bring in the jury?
I don't think so.
So to be clear, at this point in time, and I'm not making this, but are we admitting 3035, 12, 22, 23, 24, and 25? Is that correct?
Yes, Your Honor.
I believe so.
Oh, wait. You know,
I don't. There's a portion of that, I beg your pardon, Judge. There's a portion of 24, I believe it is, that does make reference to dependency court proceedings that I would like to redact before it gets admitted to evidence.
Well, again, I'm not fond of this entire exercise, but be that as it may, I feel like Johns Hopkins, by its questioning, has put the issue of Nemours squarely into contention here, and the plaintiff has a right to discuss that.
I don't quibble with that a bit, Judge. That's not the point. That's not the point of what I'm saying.
If they'll withdraw the testimony, the attempted cross on something that was not in evidence, then I'm fine, and we can go home.
Just for the record, I didn't question the doctor on a single record from the Moors. It was about the records from all children that were in evidence.
Yeah, the testimony that is, the testimony stands at this point. So the question is, and again, it's the same question I asked you 10 or 15 minutes ago. Are you going to want to use this witness to talk about those factual questions that we just were talking about and your opinion on Munchausen by proxy that you just elicited, or are you not?
How long do you plan to go today, Judge?
What can I do to get an answer out of you?
I think use it.
Okay, so then my question is 12, 22, 23, 24, and 25, and I now am hearing from Mr. Hunter that he has an objection to 25, which we should have probably told me 30 or 45 minutes ago. So
It's basically the bottom of 24, Judge.
can someone put up 24, please?
Is that 24?
Okay, what specifically are you talking about?
It makes reference to having an order in place.
Just tell me the specific language that you're talking about.
Patient.
Patient must
Just
have
go ahead
court
and
order.
admit it, Judge. I'm sorry.
So a patient must have court order in place to be transferred?
Yeah.
Is that what you're talking about?
I was talking about the reference to the court order, and there was one in here earlier there was reference being made to the family being in court in front of the judge and would not be available until the next morning. That was what I was really concerned about.
I mean, is it any surprise to the jury that there were dependency court proceedings going on? And we're not trying that case, but,
Okay, as long as that's understood, go ahead, Judge, I'm sorry.
okay. So the court at this time, Madam Clerk, is going to receive 3035 pages 12, 22, 23, 24, and 25. And let's go ahead and bring in the jury. Okay, everyone, please be seated. Members of the jury, I want to confirm while you're away, you did not discuss this case amongst yourselves, you did no investigation, and you received no information. Is that all correct? Correct. And I want to confirm that since the last time you were with us, you were not approached by anyone about this case? Correct. And that you have not seen any media coverage concerning this case? Correct. Okay. And I'll have to tell you, my wife always loves when I said it's 5 minutes. I seem to have a very elastic sense of time when it comes to 5 minutes. At least it wasn't one time I was with her and I said 5 minutes, and 4 hours later I was still at the office working. So I apologize, but sometimes things just take a little bit longer, and I'm glad I didn't have you sit here while we were having that discussion. So.
And you're still married.
And I'm still married, which is the biggest surprise of all. Mr. Anderson.
May it please the court. Insofar as the specifics of the day-to-day, month-to-month care of Maya Kowalski, would you defer to our physiatrist who has worked that out? Your opinion, would you defer to the physiatrist for the day-to-day minutia of the care?
I didn't, you'll have to rephrase it. I didn't get that question.
Don't worry about it. Okay. On cross, you were asked about an authoritative source, and I believe you answered that that it wasn't authoritative, and it might have been authoritative, but do you know if we can put up 1001 to 2718? Okay, I'm shifting gears because that's not the one I wanted, but I can use this one to get that point, which is my next one. You were shown on cross-examination this. Can we highlight that middle, the entire paragraph instead of just the top? And can you read to yourself the reason why Beata Kowalski said she's not allowed to eat? What's a TPN?
It's called, TPN stands for parenteral nutrition. I forget the first T, what the T stands for, but it's nutrition that's given through an IV.
And is TPN a ban on feeding until the diagnosis could be understood by the hospital?
No, there's nothing wrong on giving TPN. I mean, there are some risks involved when you give someone TPN.
Okay. And did it come to your attention, though, that there was an order from Johns Hopkins that prohibited Maya from eating until they actually diagnosed what was wrong with her stomach?
Objection, lack of foundation.
I wasn't aware of that rule, but that would be standard practice.
And so, if this is standard practice, and there was, in fact, such an order, would it be reasonable for Beata Kowalski to inform whatever the nurse was or whomever that Maya couldn't eat because there was an order saying not to eat?
Objection, it's lack of foundation, it's also speculation on the state of mind.
Well, it says that Beata said that she is not allowed to eat, that she was just quoting the hospital orders, which the nurse should have known.
Yep. Okay. There was also a question about a tethered cord. Let me show you Exhibit 1028-147. And I'll ask you there if we can highlight the line where he says the patient and father state she saw her GP. What's a GP?
General practitioner.
And so what's happening here? What does it show insofar as Jack Kowalski following up on the tethered cord recommendation you made?
He did follow up.
Let me show you then 2004-44. It's the MRI and Dr. Wassenauer's records. Now, there are no findings there of tether cord, are there?
No.
Does it appear to you then that the Kowalskis followed up on your recommendation and found that now that they had the test results, there was no tethered cord?
There was no tethered cord. They did follow up on it. Yes.
You were asked on cross-examination about what was an authoritative source, and it was specifically the guidelines. I'm forgetting the phrase that they used.
Consensus guidelines.
The consensus guidelines. Do you recall that testimony?
Well, I was reminded about it. Yes.
Okay. And you said you were aware of it. Does it show that Stephen Cohen is one of the authors of that?
Yes, he's the first author on it.
And tell the jury who Dr. Stephen Cohen works for.
John Hopkins, All Children's.
There's an objection to move to strike as inaccurate. I move to strike it as an inaccurate statement.
It's just Johns Hopkins.
You can overrule.
Thank you. All right. So now turning to whether or not the Kowalskis actually transferred or the reasons, let me show you what's been previously marked into evidence as 3035-0024. If we could bring that up. All right, let's see it. All right.
I have it here.
All right. And so in this, does it appear to be from Nemours?
Yes.
And does it appear to be a transfer nurse that is creating the progress note?
So, for the ladies and gentlemen of the jury, just want to explain. When a patient is transferred from one hospital to another, the second hospital sends over a nurse who does an assessment. And then based on the assessment, the second hospital will decide whether they want this patient or not. And that's this report.
So if you look at under Sandra Perez, MSW, and does it say that she met with the Johns Hopkins people?
She met with, yes, she did meet with them.
All right. Is one of the diagnoses already made and placed into this Munchausen by proxy?
Yes.
Doctor, what happens, and you previously discussed this, when a diagnosis like this is put into a patient's records.
I object to this.
He's
This
already
is-
testified about narratives.
That question I'm sustaining.
If I,
One second, sir, I sustained, so Mr. Anderson's gonna have to ask you another question.
okay,
What, if any, effect in your practice as a physician does having this Munchausen by proxy in the record
Same objection.
I'm sustaining,
as opinion?
yes.
Right. Well then, does it say that Johns Hopkins told them it was Munchausen by proxy
Objection.
among the?
Overruled the objection, you can ask that question.
Does it say Munchausen by proxy is one of the diagnoses?
okay, I have an opinion on this.
Please.
Can I say? Okay. For one, they
Objection, Your Honor. Same objection.
well, the jury needs to know the truth.
Sir, what I need is you to answer the specific question that was asked.
Okay,
Which I have now forgot.
the question that you'd asked was, is Munchausen? No, what?
What happens when, well, that one's already been overruled. I said, was Munchausen's by proxy assigned by a Dr. Dees with Johns Hopkins?
Yes,
And did Maya have Munchausen, or did Beata have Munchausen by proxy?
no,
And is that a psychiatric diagnosis?
yes,
Is it a negative psychiatric diagnosis?
Objection.
it's a grossly
Overruled, you can, the answer stands.
it's a grossly negative psychiatric diagnosis.
All right. And so, if you look at the bottom, does there appear to be some editorial about Maya with Johns Hopkins?
What do you mean by editorial?
Okay. Was there a comment made about whether or not she could clearly move her arms to do so?
Yes,
All right. And so, in the actual diagnosis for the transfer, which the Kowalskis would have to consent to, obviously, was there a finding that was, in effect, an admission that if they signed, it would be Munchausen by proxy, they would agree to it?
Objection, Your Honor, and scope and foundation relevance outside.
Mr. Court Reporter, can I have that question again, please?
Okay, and so in the actual diagnosis for the transfer, which the Kowalskis would have to consent to, obviously, was there a finding that was in effect an admission that if they assigned it would be Munchausen by proxy, they would agree to it?
I'm going to overrule the objection, you can answer that question.
yes.
No, I could say.
If the Kowalskis signed it, they would be admitting that they have Munchausen by proxy.
Thank you, Your Honor.
Is it defense term?
Just very briefly.
Well, one last question. Was this transfer notice for the purpose of CRPS treatment or for a psychological psychiatric treatment?
Objection.
Sustained.
Nothing further.
Okay. Very briefly, Your Honor.
Yes.
Just because you were asked about Munchausen's and prior psychiatric diagnoses, are you aware of whether records prior to All Children's Hospital also contained those suspicions or diagnoses?
That's irrelevant.
I asked you if you were aware of whether other institutions prior to All Children's had also made those diagnoses or suspicions.
I'm just trying to think of the hospitals. No, I'm not aware of any.
So the totality of the records that you reviewed and everything you reviewed, you don't remember ever seeing either at Tampa General or Lurie's Hospital prior to All Children's, their records containing either diagnoses or suspicions from other physicians about either Munchausen's or other psychiatric disorders. You don't remember ever seeing it.
Objection.
I know.
Across because facts are not in evidence. No.
I don't recall any of them diagnosing.
That's all. Thank you, Doctor.
Anything further from the claims?
No, Your You didn't see.
You don't understand. The
expect
jury
that.
actually gets asked questions too.
Are you serious? It's a nice day.
Members of the jury, do any of you have questions for the doctor? I see at least 1, 2, 3. Lawyers, please come forward.
Seriously?
Notes. I know you're trying to conserve paper, but we have enough paper for your notes. Just pull the whole sheet of paper, please. Thank you. Hey, Dr. Chopra, I have quite a few questions from the jury. Do you have an opinion on how Maya's CRPS started?
That's actually a very good question, and the answer is no, I don't know. What had happened was she was admitted, and that was before this case. She was admitted to the same hospital. She had been given very high doses of steroid for her asthma. And at that point, she developed pain in both her legs. And that was eventually diagnosed as CRPS, but we never could find out why. And that does happen in CRPS.
So the attorneys are aware, based on how he answered that question. I'm not going to ask the next follow-up on that.
Yes, Your Honor.
The next question, is ketamine addictive physically or psychologically?
No, not at all. Not at all addictive.
Does ketamine cause constipation or continued use cause obstination?
No, not at all.
How do you simultaneously acknowledge this case is rare and unknown, but also answer that the treatment would have a certain outcome? What's the basis for your belief? Is it opinion or science?
I didn't understand that.
Okay. How do you simultaneously acknowledge this case is rare and unknown, but also answer that the treatment would have a certain outcome?
You mean case or the condition?
I think the question is case, but the attorneys and then the jury can follow up if I'm misunderstanding the question.
Well, I'll address both. CRPS is officially considered to be a rare condition, officially. But in reality, the incidence is actually very high. I have it here. It's about 200,000 cases per year, and the incidence is about 7% in children per year. It's officially considered rare because no one has gotten around to, because it gets missed all the time, so people haven't been able to accurately get figures as how many people actually have CRPS and was missed. This case of where a child developed CRPS and was accused of, parents were accused of child abuse, and then ending in a mother's suicide, is actually very common. It is worrisome, and it is extremely common, more than you would think.
The follow-up to that, what's the basis for your belief? Is it opinion or science?
Belief of what?
Your answer just immediately before.
Oh, no, these are all facts. It's not my belief. It's not a rare condition, but that's my belief. It's not a rare condition. And it's a general consensus also. It's just that we haven't gotten the data going. No one has bothered to collect the data. So it's still considered a rare condition. And a lot of people want it to remain as a rare, patients want it to remain as a rare condition because the FDA then approves drugs easily for rare conditions. So a lot of people want that. And it's not, so it's my belief is it's not a rare condition, but the official statement is that. Any other beliefs?
Well, the next question
There's a question.
is, and this is going back to ketamine, are there withdrawal side effects after long-term ketamine treatments?
No, not at all. No, you can be on ketamine continuously, and it happens. You can be on ketamine. Hospitals will put a patient on ketamine infusion continuously for 10 days, and then abruptly stop it, go home, and nothing, no withdrawal at all. That's the beauty of this drug.
And the last question at this time from the jury. Is it more common for the onset of CRPS symptoms to gradually progress or to just appear one day with excruciating pain?
No. This condition, if you don't treat it, just keeps progressing, and eventually just keeps progressing till the patient eventually becomes bedridden, and then it's the end of it. It doesn't get better on its own, ever.
Plaintiffs, are there any follow-up questions?
Yes, Doctor, part of your review, were you able to determine whether in those instances where Maya went off ketamine, such as after Dr. Kirkpatrick, and before she went to Mexico, whether she ever experienced any withdrawal symptoms?
No, you don't. You don't get withdrawal from ketamine. I mean, she came back from Mexico and she didn't have withdrawal. No, you don't get withdrawal from ketamine.
And can you tell the jury, just so that when they're back there looking, what if it were to be withdrawal, if it was an opioid-like withdrawal, which I think is what they're thinking, what would you expect to see in her records?
Oh, she would have tremor, like any other withdrawal. She would have tremors and, what's it called? Feeling like bugs under your skin, and all of those symptoms. Severe nausea, severe nausea.
All right, and it's sort of similar to alcohol or nicotine or substance, any addictive substance?
Kind of.
But ketamine, is ketamine addictive?
Not at all.
Your witness. Oh, one more. Can ketamine, have you seen in your career asthma attacks cause CRPS?
No, there's no direct correlation in that. There may be an indirect correlation, but not a direct correlation.
Thank you, Doctor.
I'm only going to owe you $1.
Is there a
One question, $1.
Is there a stop period? Do you have a button to push for stop?
I told you I'd pay you your $1. Yeah, it's going to be quick, I promise. Just to follow up on one of the jurors' excellent questions. The side effects of ketamine, those include nausea, vomiting, colorful dreams, hallucinations, and headaches, correct?
Yes, but I need to elaborate on that. If you give someone a whole lot of ketamine suddenly, let's say I gave you 200 milligrams of ketamine as one shot, you would have all of those. You would be seeing pink elephants flying around this room. But if you give 200 milligrams over 4 hours, you'd be fine.
Okay. So high doses of ketamine would cause those side effects, correct?
Again, high doses of ketamine given slowly over time, you probably will not see that effect.
Those are the potential side effects of ketamine.
Those are the potential, yeah.
Okay. I owe you $3.
Oh, yeah, I know. And $4 there, $7 today. My day is done.
No other questions?
Members of the jury, do any of you have any further questions? None. May this witness be excused at this time.
I may hold him for potential recall later, but he may be dismissed today.
Okay. So, sir, what that means is you're free to go today. It's possible they might ask you back. So let's not talk about our testimony with anybody except for the lawyers, okay?
Okay. He hates me.
Thank you for being here, and have a good afternoon.
Thank you very much.
Okay.
Am I supposed to leave first before everyone?
You can go right now.
Oh, cool.
And you might want to leave before we change our mind.
I know, these are these days. Thank you.
Okay. Members of the jury, let's take care of a few housekeeping items. That's going to be our last witness today. So I know it's only 4 o'clock, and I'm sure you're really upset that we're leaving at 4 as opposed to 5. I know that there was a request earlier to kind of know what the schedule is. And I will tell you, I have been discussing that with the lawyers, and I should be able to tell you tomorrow what our schedule is next week. And it's my intent, hopefully by the Friday of each week, to kind of give you a preview about what the following week's going to be, and if we're going to have some time. When I say time off, it's really time off for the jury, because there are other things that we are doing outside your presence. So when I say time off, don't assume that we're not working. I will tell you the logistics that go into a trial are extremely difficult. And before I was a judge, I was where these lawyers are, and you're balancing witnesses. They've got their own commitments and work, and that's before you even get to the life issues, like a plane gets diverted, or a delay, or someone gets sick, or someone has to go to the hospital. I mean, there's just all the life issues that go on. So we kind of build into our schedule a little bit of time to account for that. The good thing for you right this second is we are a little bit ahead of our schedule. So I'm constantly discussing with the lawyers, usually it's outside your presence, where we are, what witnesses we have going on. And the lawyers on both sides are working very hard to coordinate what witnesses are going to be here. So everybody knows when you walk through the door that we are asking witnesses questions and everyone is prepared. And so, the lawyers have done a very good job on both sides to do that. So I know that there is a desire for a schedule, and I will accommodate as best we can. Understand also that there are issues that sometimes crop up that, what will I know tomorrow might not be the same as what I know next Wednesday. And so I will do my best each Friday, if not before then, to kind of give you what the following week's preview is. Is that level of frequency sufficient for you all, or do I need to have a more rapid? Okay. I promise you that I will do that. And I do see, sure.
It would be nice if we knew that, October 15th, we would be needed here or whatever, so that we can.
I think the reference was for like, are there any known holidays or court holidays?
Well, I can tell you right this second that next Friday in the afternoon, we're not going to be here. Whether we're here the whole day, the morning or not, I don't yet know. I hear your point. There might be a day or two that I can give you this far out, but it's not going to be but maybe a day or two. I'll talk with the lawyers about that. But I just, I'll get back to you on that. But I don't think there's but maybe a day or two that I'm going to be able to tell you tomorrow, hey, on October blah, 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 we're not going to be here. So, but I will do my best. Anything else on that issue? Okay. Tomorrow, we will be here again, and tomorrow is Friday. So do not discuss this case amongst yourselves. Do not do any investigation, receive no information. And based on my new questions, also please make sure that you're not observing any sort of media reports about this case. With that, have a good afternoon, and we'll see you tomorrow at the rallying point at the same time. Presence probably is a good thing that Dr. Kirkpatrick wasn't here today. do we need a break before we talk about whatever we need, or do you want to keep going?
Can we keep going? 'Cause
Okay,
Keep going, see how quick we can get out of here, Judge.
keep going it is. So what's the next issue? Obviously, the jury's out of our presence. What's the next issue we need to address?
Judge,
None by plaintiff.
Judge, I'd like to reprise my concern that I raised or made briefly, brought the court's attention to briefly this morning regarding trial publicity. Yesterday, there was telecast on Court TV an interview from Mr. Anderson in which he made reference to a Nuremberg defense, to the merits of the defense, and then he made reference to his confidence that when the jury hears how the DCF proceeding was manipulated behind the scenes, that they would act in a certain way. What concerns me about that, there's a number of different concerns about that, not the least of which is the nature of the reference to a defense asserted by Nazis. But there's also a very real publicity issue with respect to what the jury hasn't heard or what the court is going to let the jury hear about something behind the scenes, which suggests to me that there is reference to matters which are not yet in evidence and may never be in evidence. And I have a concern about that from the standpoint of, again, of jurors being approached by outsiders and that subject being brought up to them and having, as a result, a juror who otherwise is trying to abide by this court's admonitions tainted in some way by trial publicity. Counsel has indicated his concern about publicity that has been, or comments that have been made in the media by the defense team at one point or another. I would say to the court that one of those concerns regarding Facebook posts by a spouse has been stopped definitively and will remain so. Otherwise, you have not heard any comment from the defense team regarding what's going on in this trial, and as far as I'm concerned, you won't. I would ask that the court basically make clear that we should not be engaging in publicity during this trial, certainly not engaging in comment on what the evidence may show or not, and certainly not talking about or editorializing regarding the merits of the opposing party's case or lack thereof. So that's the concern we've got, Judge, and I'm sure that Mr. Anderson's got something to say about it, but I don't think that it's untoward for the court to admonish all concerned that the place to try the case is in here, not out there.
Well, let me ask you this. Is there, other than a concern, a generalized concern, is there any basis of belief that there is tainting to this jury?
You've seen the same thing I've seen, Judge. I have no information at this point that the jurors have strayed from your instructions or that they intend to. Okay. My concern is not so much what the jurors may voluntarily do. My concern is more what the jurors may be confronted with as a result of this, or what pressure may be exerted on them as a result of an outsider or a third party's belief that these defendants are acting as if they were Nazis at Nuremberg, or acting as if they were manipulating the court behind the scenes, or some other nefarious activity of that nature. It doesn't assist the court or anyone for outside influence in the ecosystem of society out there to be in a position or even potentially to influence jurors or to exert pressure on jurors, even make jurors feel like that there's pressure being exerted on them. So that's my point, Judge. I can't sit here, I can't stand here and tell Your Honor that I'm aware of anything actually having been done to take that jury so far. But what I can do and what I am doing is standing here and asking that we all take steps to make sure that it doesn't happen going forward.
Mr. Anderson?
First, Judge, I want to assure the court that I am very much aware of Rule 4-3.6 on trial publicity. And I know that I am not to be revealing facts. Schedules, fine. General view about the trial, fine. I looked it up. You can't put facts out there that are possibly not going before the jury, and you can't elaborate on those facts because, again, that is an outside source for the the jury to somehow access. And I have not done that. The defendants, however, have repeatedly in multiple different media. I've just got one from the Daily Mail, but it appeared in the Tampa and the Tampa Bay Times. Exclusive. Maya Kowalski's mom, Beata, was fraudulently writing prescriptions for her daughter and faces charges before she killed herself. Florida hospital who accused her of Munchausen by proxy claims. And that was from counsel here, attributed in any event to counsel. We asked them to take that down and withdraw that allegation because the court may recall that we had a hearing on a motion in limine because that was strictly an error in coding where it went in the wrong column. And the court saw that. But before we had an order from the court, the defense completely withdrew it, which to me says more about it than anything else. So I do not intend to violate, nor would I violate in any way, an ethical rule. If I am asked how the trial's going, I'm going to say, fine, it's going well. The defense scored some points, plaintiff scored some points. And these are, if you look at it, and I take great offense at them implying that I call them Nazis. In fact, if you watch it, Judge, I specifically said, well, some people call it the Nuremberg defense. And that is a term of art among trial attorneys for blaming it on I was just following orders. Now, at the time I said that, I immediately said, I do not mean to imply in any way, just to make sure that it was taken in the context in which it was intended, which was solely to repeat a way of expressing the defense's defense that I've known for 30 years, 40 years. So I don't think we need to be admonished to follow the rules of professional responsibility. I think we're all professionals in this room, and we're going to do our best to get this case tried with a minimum amount of error.
Mr. Hunter?
I think I don't have anything else to add, Judge. I think what was said speaks for itself.
Here are my thoughts. My number one concern would be that the jury not be receiving any sort of outside influence. And even leading up to this case, I took steps to protect the identities of the jurors. As you know, every time the jury comes in, I ask them about whether there's been anything, any discussion, or if they received any information. And now at your request from this morning, I've made a little bit more specific question, and I think that's fine and appropriate. Both of you are licensed members of the Florida Bar, and you both know Rule of Professional Conduct 4-3.6. So I don't think I need to tell you that you have to follow the rules of professional conduct because that is an ongoing obligation that the lawyers have. As far as the content, certainly I've seen no indication that any of the media attention that has occurred in this case has been observed or provided information to any of our jurors. So at this point, I don't have a basis to believe that the jury has been tainted in any way, shape, or form. One of the greatest things about our country is the First Amendment and the ability to talk and to speak, the freedom of the press. And if I were to enter some sort of gag order when I don't yet have a basis to believe that any of the jurors have been approached or somehow tainted, then I'm afraid that my actions would be beyond the First Amendment of the U.S. Constitution. I'm just frankly not going to go there. Now, if there are attempts at the jurors and there comes an issue, then we might need to revisit. What the lawyers say, you're responsible for the words you say, and whether someone walks themselves into a defamation lawsuit, that's between the two parties, or a bar complaint, that's between, the parties. But that's not an issue for me. So I'm not going to take any action other than what I did this morning, which is to ask the more specific questions. And I trust both of you as members of the Florida Bar to comply with the rules regulating the Florida Bar.
We understand.
There are any questions or clarifications?
None by plaintiff.
Okay, what's the next issue?
Judge, they gave us the list of witnesses they intend to call tomorrow, one by Zoom. We object to one of the witnesses. I don't know if the court wants to hear that now.
Might as well, since we're here.
So they plan on calling Meg Boland. Miss Boland, as I understand it, was a woman that was communicating with Beata Kowalski. She didn't start communicating with her until May of 2016, so after the ketamine treatment had been decided on by the Kowalskis.
Let me make sure I understand. Are you objecting to her by Zoom or objecting to her as a
Oh, no,
witness?
not by Zoom. I'm objecting to her testifying.
Oh, okay.
I'm sorry. So her first interaction with Mrs. Kowalski is May of 2016, and she's part of this Ferocious Fighters for CRPS. She has a child at CRPS, and all the communication is through emails or Facebook or whatever, going back and forth. Everything she knows about what's going on with the Kowalskis is hearsay through Mrs. Kowalski. It's all hearsay, and the court has previously entered an order granting a motion in limine that on DIN 2580 that lay witnesses' proposed testimony about their personal experiences with CRPS is in no way relevant to the causes of action in this case. The court at present is not in a position to evaluate whether those witnesses' communications to the Kowalskis prior to the Kowalskis' determination of a ketamine therapy regimen for MK pre the hospitalization, would inform as to the Kowalski state of mind to pursue the ketamine regimen. So unless, maybe I'm missing it, Judge, and they can inform me otherwise, but Meg Boland's first interaction again was May of 2016, long after the ketamine treatment had been started. She has a son with CRPS. She has a blog, a Facebook page about it, and all of her communications and all her knowledge are hearsay with regard to the Kowalskis.
Plaintiffs.
She was also one of the last, if not the last person to speak with Beata. And those conversations, once the court hears them, we are confident that you will find a number of exceptions to the hearsay rule, not the least of which is of then existing mental, emotional, or physical condition.
When was her last conversation?
The day before Beata committed suicide.
On the 6th or the 5th?
When was it? The day of. The day of the suicide.
Is it like after or before the hearing with the dependency court?
I assume it's after, because it wasn't that in the morning.
I wasn't there.
Yeah, neither was I.
It was January 6th.
I don't know, Judge. I can't tell you if what the case was there. I do know that the statements that she will attribute to Beata Kowalski go to the state of mind, probably, although no one knew the plan, somewhat of the motive and the pain, not memory or belief. She's not going to testify about memory or belief. Any reference to her son is merely a background side reference, and I am not intending to elicit the type of testimony that counsel worries about, which I believe is other people with CRPS testifying at length about how terrible it is. I think the jury has heard how terrible it is enough. And so I'm not bringing any of that out. I am bringing out, through Ms. Boland, Beata Kowalski's state of mind and descent to the point where she took her life. And she was the person that was most talked to in our view. We can continue on the different exceptions to the hearsay rule.
Let me ask you this. So besides the conversation the day of, are you intending to elicit testimony of prior conversations?
A couple of them. And again, it's going to go to Beata's state of mind as to whether she was looking at other options, whether she had a plan regarding the continuance of the ketamine or getting Maya onto another type of regimen. It'll go to some pretty fundamental points that the defense has raised and continues to argue about whether or not this ketamine use was a Munchausen by proxy or an abuse. And the conversations where Beata relates, and they're not lengthy, but where Beata relates that, at least our parts aren't lengthy, but where Beata relates what she's doing and why she's doing it, clearly fall within the exception and are important for the jury to hear, to evaluate whether this mother was doing something crazy or whether she was of sound mind.
Judge, this is the type of genie that can't be put back in the box. I think there's going to have to be a proffer with respect to what the hearsay statement is and when it was made and under what circumstances.
Well, I don't think I can rule definitively at this point in time, because I do need to hear the circumstances of the conversation. It would seem the farther away from the date of Beata Kowalski's death, the less likely it is it's going to meet an exception to the hearsay rule. Okay. With respect to, yes, I can see a question or two about that fact that this witness has a child with CRPS, but we're not going to go into that witness's trials and tribulations with CRPS. We're not going to get into any sort of advocacy on CRPS. It's just my child has CRPS. You know,
Yes, Your Honor.
she and I bonded, or whatever it is.
Yes, sir.
Okay.
You
But
have this
I agree with Ms. Crowell's. I probably do need a proffer. Now, is she going to appear by Zoom, or is she?
She's appearing by Zoom.
Did we let my judicial assistant know so we can get an email address for her to send the panelist information?
You what? Oh, we didn't know that was part of the procedure, but we'll take care of it right now.
I need panelists, and like, if a person's going to testify by Zoom, I think I put this in the order. We need to know their specific email address, because for security purposes, it's only going to be a single link to one person.
Right.
And it's not going to be to you, when I say you being the plaintiffs, for you to forward on. It's got to be directly to the person who will be coming in. So we definitely need that, the name and the email address. Now, what time were you anticipating this witness testifying?
She's later in the day. I think she would be probably around 2. She's going to be after lunch.
So perhaps either before we go to lunch or after we go to lunch, we might need to have that proffer. Is that what I'm hearing?
Whenever they're going to call her, Judge. I mean, I definitely think we need a proffer because, again,
Yeah,
it's going to be hard to
I
handle
agree,
that otherwise.
I agree with you, Ms. Crowells. We'll do a proffer with respect to her proposed testimony.
Will the proffer be allocated against our time, Your Honor?
Well, it's not in front of the jury.
All right.
And speaking of time, just so you know, today plaintiff's 3 hours, 10 minutes for a cumulative running total of 10 hours, 15 minutes. Defense 1 hour, 15 minutes for a cumulative total of 3 hours, 25 minutes.
So where were we again, plaintiffs?
You're at 54 hours and 55 minutes.
I mean, Dr. Chopra put you up to that.
10 hours, 15 minutes total.
All right.
Okay, so what's the next issue?
Judge, oh, I'm sorry, do you want?
Ms.
do you want
Perez?
next? Okay, Judge, recall, we started talking about this, but then we didn't have time this morning. During Dr. Duncan's testimony, Mr. Whitney stated at the beginning of a question, which I have the transcript of now, which said, if the record shows that MK did complain to the doctors at the hospital of physical and sexual abuse on multiple occasions, and then we stopped it and we approached the bench, and the judge informed the jury to ignore the statement. But we're concerned that that's not sufficient, and we would like the court to instruct the jury that there is no claim for sexual abuse by the Kowalskis. And there's no evidence that
Probably the time.
she complained to the, I'm sorry?
This is probably the time. So it's a bit of a story. When we were looking to dismiss Ms. Beatty, I had a conversation with my client, Maya Kowalski. And in fact, it's two texts which, without waiving the attorney-client privilege, I can provide to the court as to the day, which is about whenever we dismissed, I think it was last week. And she informed me that she had, before the 17th, because it's noted in Dr. Katzenstein's notes, she will testify that, well, let me continue the story. I said, Maya, we're going to dismiss Ms. Beatty. Now, are you telling me every single encounter you had there? I need to know every single encounter, no matter how big or small you think it is. And she told me one story about them dancing around her to try to get her to get out of bed and dance, and we know about this. Then she broke down, and then she told me that she had a doctor come in, and she figured it was a doctor because she described him as being tall, thin, glasses, I think she said round glasses, and dirty blonde hair. With a lab coat on, she could identify his belt and his pants. The doctor walked in, male, without chaperone or assistant. The doctor walked over to her and said, may I take a peek? The doctor pulled down Maya's pajamas. This was pretty late in the day. I know it was short shorts or pajamas, but it had a drawstring. Pulled them down, pulled her panties down, and then stared at her vagina for, Maya said, long enough for her to be not only startled, but start to cry. Whereupon he turned around, went to the door, turned around his shoulder and said, thanks. She never saw him again. Now, as an officer of the court, I will swear everywhere, had I known anything about this, I would have immediately brought it to the attention of both the court and to opposing counsel. I then waited. I've waited for the past 3 or 4 days, however long it's been, because I wanted to corroborate before I brought this before the court. So Maya was able to locate a witness where approximately 2 years, a little less than 2 years after it happened, she told a young man who was a friend of hers what happened, and he is willing to testify about it. Then I went to Dr. Katzenstein's notes, and there's a very cryptic reference in there. And it says first, this is why I didn't catch it, first it says she denies any sexual behavior, misconduct, whatever. Then it does say, she does say a doctor, what was the exact terminology?
I'll get the exhibit number out for them.
We're going to pull it up for you, Judge, so you can see it. Anyway, we'll show you the exact language, but it was words, I'm losing my place here. It was words to the effect of the child, or I'm not sure, we're going to see in a second, did say that a doctor pulled her pants down, and she was, I forget on the thing, it's been a long day, on the actual note, whether she said she was scared or whatever. I have checked this out with every psychiatrist we've got, and we've got a lot of them, as the court has seen, in an abstract manner, not referencing anything about the testimony here, but simply about repression, suppression of these kind of events. And I have learned that for children, these events are typically suppressed, and they are not brought out for years, which is why we don't have a statute of limitations on this type of behavior. And so I didn't know exactly when to bring it to the court's attention, except until I had corroborating evidence and I had determined that there was a profound reason why Maya did not say what she said. She is now old enough where she can explain it without, well, she'll still break down, but it is obviously upsetting to her. It was completely inappropriate. I don't know who the doctor was. I do know that Beata does not lie. And she said it was a Johns Hopkins lab coat, which she's very familiar with the Johns Hopkins insignia on the side. Which puts me in a quandary because we neither pled that nor informed the defense of it because we had absolutely no idea. And the note placed after the phrase child denies sexual abuse made me think that that episode was just a normal doctor visit and made me think that it was before she ever went to Johns Hopkins. I mean, it's there on the bottom, and for the record. She denied a history of sexual abuse. She stated that one time previously a doctor had looked at her private parts but did not touch her, and it made her feel uncomfortable. And we believe, and we would like to add, to ask Dr. Katzenstein about this. And
Whose note is this?
This is Dr. Wasnauer's note.
no. This is a Johns Hopkins psychology note written by Dr. Katzenstein.
I beg your pardon, it says primary care physician, Dr. Wasnauer.
And it's from what time?
It was, this was on October 17th of 16, so she would have been in there approximately a week at the time. And so I then looked up the law, and obviously, Judge, you have very broad discretion here.
Obviously, this is something new.
Put it politely.
I'm sorry?
To put it politely.
I would have brought it to everybody's attention sooner, but I'm not going to release any of that kind of stuff unless I know.
This is how I think we should handle it. This is not a ruling, this is a suggestion. Let me get the party's view. And perhaps this is memo time in the future and not to answer right now. Obviously, we've got a question of late disclosure and whether it's within the pleadings or not. So perhaps what I need to understand is what the plaintiffs are asking the court specifically to do or not to do. And then we'll give the defense an opportunity to respond. I mean, and I think this is probably one of those that we probably need writing and we need case law and to be clear as to what it is that you are actually seeking, Mr. Anderson. So
Yes, sir.
perhaps, and I don't think you're putting Ms. Kowalski on next week.
No.
If you were to provide your position, maybe let's see, tomorrow's Friday, by like noon on Saturday, and then let the defense have until, when I say close of business, probably the end of Monday to respond, and then on Tuesday we can have a dedicated discussion to the issue. Just as a spitballing ideas here. What?
That sounds fine, Judge. I mean, our requests are pretty obvious, but I agree we should all think about it, especially the defense. I have been in their position before. It's an unpleasant position. I know they'll object, but I think both sides need time to review this.
Your Honor, if I may, it's totally outside the pleadings. Not only is it new, so the only motion they can file is, at this point in time, is a motion, if they wanted to do it in this lawsuit and not some other lawsuit down the road. If they want to do it in this lawsuit, they got to file a motion to amend their pleadings to add that to the complaint. And we can start this trial another year from now. But they can't try that in this case.
Well, I think because of the subject matter and the weightiness of what Mr. Anderson is saying, I kind of want to have a more formal process. I want to know specifically what the request is, and then we'll be able to review the defense's response, and I feel that might give me an ability to be able to make a more informed decision as opposed to just sitting up here and making this. Now, before all of that disclosure by Mr. Anderson occurred, my thought, Ms. Crowells, was going to be, let's kind of wait and see, because I felt that the instruction I gave yesterday was sufficient to inform the jury that that's not an issue. And so, could I be talked into an instruction later on when we're going through the entirety of the instructions? Yes, but if I were to do it, let's say if I just did it tomorrow, let's say, I think at that point I'm actually focusing and highlighting the issue, which I think would be worse. So I was comfortable yesterday with the proposed resolution that the defense suggested and I agreed with. And so nothing having to do with Mr. Anderson's disclosure, I probably wouldn't have done it given a further instruction on it in mid-trial. So, is the timing frame like noon on Saturday for the plaintiffs to file whatever they're going to file, and then sometime before midnight on Monday, a response? Are those times enough?
Yes, Your Honor.
Okay, so that's what it'll be. Madam Clerk, notes will say that there won't be any formal order, but the plaintiffs will have it until noon on Saturday and then midnight on Monday night for the defense. And when you are filing your responses, please use that email that we used right before the trial to send a courtesy copy so I can grab it, because the clerk won't be able to docket those things over the weekend or at midnight.
Right.
Okay.
We have one other issue briefly.
Yes, sir. Is this before Mr. Altenberg, who's been so pleasantly waiting for days?
Oh,
Can we get a reminder of that email address, if not now, tomorrow? I think we may have misplaced it.
I'm hopefully sure that your assistants can do it. I don't want to do it publicly.
That would be bad.
one of
Next issue.
One of the witnesses for tomorrow is Ms. Deborah Hansen. Ms. Hansen is a former social worker at Johns Hopkins Children's Hospital. As far as I know, life is becoming full of surprises. As far as I know, her only involvement in this case was an early encounter with the Kowalskis and the fact that she phoned in the first report to DCF. And I'm trying to divine what the purpose of her testimony may be and why it is that she's being called as a witness in the case. If that's the purpose of calling her, we're going to submit that that testimony is irrelevant given the court's ruling.
Well, the fact of it obviously has come in or will come in, and I am not calling her to extemporize on making the call. I believe she made the first or second call. I think she actually made the first call. But she was there working in the PICU during this period of time when Maya was brought in and is witness to certain events. She is not a managerial employee. She has been gone from Johns Hopkins for years. She is a counselor and teacher at a very, very good boarding school in New England now. And her testimony will circle around party admissions at the time of Maya's being brought in. And she was an eyewitness to several events that are exceedingly relevant and material to this trial.
Is she going to be live?
She's going to be live. She's here.
Judge, I brought up the issue of her report, and that's the only issue that concerns me. Obviously, if she sees other matters that are material and relevant, we can deal with that.
Okay. I don't think there's anything I can rule on at this point, so.
That was the only reason I brought it up was because of the report issue.
Any other issue other than the Mr. Altenburn issue from either side?
No.
Okay, Mr. Altenburn. And have you spoken with Mr. Elliott?
I have spoken with Mr. Elliott, and I got an email from him about 3 o'clock that indicated he wasn't too clear there was a hearing today, so.
It's okay. I worked with Mr. Elliott last night, and I can cover what we've agreed to here or not agreed to.
Well, have you seen my amalgamation of the parties' requests? So what are your thoughts?
And my only, one thing, you have just a sentence that you did a double on. At the very, before the last paragraph, the sentence, "These three false imprisonment claims are not claims," is actually the first sentence of the next paragraph, I think. It just has an "and" in it in the next sentence.
So I doubled the same sentence, huh?
Yeah.
So that sentence should read, "These three false imprisonment claims are not claims about Maya Kowalski's custody
Period.
and are not impacted by the dependency court's custody order."
I think that would be fine. And the last sentence, my only concern is that the way this case is being tried, I don't honestly know whether the shelter order or the custody order, I should be more specific, will have any effect on all of the other claims. It shouldn't have any claim on medical malpractice, and I don't think it has any claim on battery. I'm not quite so sure about intentional infliction of emotional distress. So I had worried about the language of that sentence, but I discussed that with Mr. Whitten, and I believe that if for some reason that becomes an issue down the road, I could ask for some clarification on that. But I doubt that this is going to be something that's going to catch the jury's ear in a fashion that will confuse them down the road.
So let me see if I can translate what I'm hearing. You want me to say these three false imprisonment claims are not claims about Maya Kowalski's custody and are not impacted by the dependency court's custody order, period, and then not read that next sentence.
I would prefer not that sentence, or at least, or maybe just to mention medical malpractice and battery if you were going to do that. But we had gone back and forth, and that was a sentence that I had taken out of my proposal and given you the one that basically said that it wasn't relevant to these other counts.
Okay, I guess let me make sure I understand, because I don't think I understand.
Okay.
You want me to, that clause, and are not impacted by the dependency court's custody order. Are you okay with that or not?
Yeah,
okay?
the first sentence is totally fine. It's just the last sentence.
It's that last sentence.
And I actually would just prefer to leave it out, but if we're going to leave it in, I would prefer the plaintiff's claims for medical malpractice and battery are not affected by the order, and leave it at that, because I'm not sure about all the other claims.
And Mr. Whitney, what do you say about that last sentence?
We prefer to have that sentence in. The fact that you only see medical malpractice or battery there was done specifically for this concern of the defense, which is the custody orders may at some time become impactful on, let's say, the negligent infliction of emotional distress or intentional infliction of emotional distress. So this is the first time I'm hearing that that should be stricken. What we discussed earlier this afternoon was that he was agreeable to that language because it only mentions medical malpractice or battery, which neither side has devised any way in which those would be impacted by the custody orders at this point.
Well, how about a more affirmative statement? The plaintiff's claims for medical malpractice or battery are not affected by the dependency court's order.
I don't object to that.
And again, does it say and others, or does it say just
He's taking out others for now.
I would really prefer to have others. I really don't want to send the jury a message in any way, shape, or form. And I particularly don't want the defense to capitalize on any ideas that it somehow affects the remaining causes of action. So, an abundance of caution, I'd like to leave it in.
Well, if it becomes necessary, why at the end of the court, why can't I say it, you know, this custody order has no bearing on the following claims?
Oh, I believe that the court will. I believe that you will.
So for today, I tend to agree with Mr. Altenburn. I like a more direct sentence as opposed to, you know, such as. So plaintiff's claims for medical malpractice or battery are not affected by the dependency court's order.
Well, not our objection. We just do not want the jury led to believe that they might affect the other counts, but we understand the court's ruling.
I don't think it's that big of a deal. I don't think that nuance is something they're going to focus on, and even if they did, I think a instruction at the end specifically identifying the counts could alleviate any possible concern that you had. And
Very good, Ron.
We have two other concerns.
okay,
If you turn to the first page, Your Honor, and I think we have agreement on this one. This is the second, the largest paragraph on the page there.
the one that starts after that report was made.
Yes, Your Honor. The fourth and fifth sentence says, the dependency court made the decision to keep Maya Kowalski at Johns Hopkins All Children's Hospital. We agreed that we would add to the end of that sentence, after October 13th.
Wouldn't it be on October 13th? Because isn't that what the dependency
You know,
court?
actually, to be really clear with you, the order is entered on the 14th, but it's one of those shelter orders that has the nunc pro tunc. They were taken into custody on the 13th at 2:30 in the a.m. But
Because the judge did this like at 2:30 in the morning,
yeah,
if I remember correctly.
some judge did this at 2:30 in the morning. I'm not clear about who that was.
And I don't recall, but
And I
normally they would then go to first appearance
And actually,
that-
before first appearance, they went to a shelter hearing.
at 9 a.m. that
and
next
at
morning.
The next day on the 14th. So on the 14th is when he said, when basically, it's not that he's keeping them there, it's a continuation of that, but he's worried about his false imprisonment claim, which cuts off on the 13th.
Okay, so you want to say after October 13th?
Are we saying, the order's the 14th, I guess we should change these dates to the 14th.
No, because the order has a retroactive finding in it. Because the written order is entered differently than
Does someone have the physical order I can actually look at?
I do.
Okay, so the dependency court did this at 2:30 a.m. on the 14th.
On the 13th.
I don't think so.
Yeah. Can I approach, Your Honor? And I can show you on the document.
Okay, sure. Let's see, the clerk's stamp is the 14th.
Yeah, but the front end of a shelter order, it'll tell you when the child was taken into custody. And in the front end, someplace on that first page, there's a statement that the child was taken into custody.
On the 13th.
On the 13th at 2:30 a.m. I think that's normally done with an oral ruling from a court, and then the shelter order normally is later. This is not the first time I've seen an order that looks like that.
Okay, so what I heard Mr. Whitney say is the parties agreed to, where it says dependency court made the decision to keep Maya Kowalski at Johns Hopkins All Children's Hospital after October 13th.
Right, and I think that's an accurate statement of fact and law.
Then let's go with that.
Can I just say we'd reserve on coming back to this later when we have a chance to look at that order closer. But
Yes.
for now, we're fine. And then I have one more issue when Your Honor's ready.
Yes.
The next paragraph, the third paragraph, it reads, "You have heard witnesses suggest that Johns Hopkins All Children's Hospital took Maya Kowalski from her parents. We think the testimony offered was accurate. We think we object to this being included. We think it belittles our witnesses and prior testimony, and similar to the court's concern a few minutes ago, we think it would simply highlight the issue that has now passed. So we'd object to that first sentence."
I am comfortable with paragraph 3 in its entirety as it's presented here. I think it's accurate and I think it needs to happen.
Well,
Anything else?
I guess we've made our record, right?
I know you don't want it.
You're going to read that
that's
first
the way the
thing in the
ball
morning.
bounces.
Mr. Altenburn asks when I'm going to read it. Unless there's a reason not to, I think I would just do it at the beginning of the day tomorrow.
Thank you.
Okay. So everybody knows who the witnesses are tomorrow.
Yep, I believe so. I mean, we're communicating with them as much as we.
And we've gotten to my judicial assistant the name and email address so she can get.
Come over and get the email addresses that we need.
Your assistant kindly just emailed us
Okay.
that information.
There we go. Anything else? Since there's still 9 minutes before 5 o'clock on the day, we're only going to be here half day.
30 seconds. We just need exhibits for tomorrow, Judge.
Job, the exhibit list, exhibits.
What am I supposed to do?
We'll have it to them within an hour, 5:30, 6 o'clock. She's been here all day. We hope to have a half day, so.
Is it a lot or a little? It's a short. Please do it as soon as possible. And I don't want to start creeping a lunchtime deadline to 5 to 5:36, then to 9 o'clock, and then 11 o'clock. I really want us to get it around lunchtime because they need time too.
I understand. I've been a victim of that, and getting the opposition's information at midnight is no fun.
Okay.
Sleep-wise.
Thank you all very much. We'll be in recess until tomorrow at 8:30 in the morning. Okay, feel free to move around. I'm just going to clean up.